Okay, so this is part 1 of Unit 1 for Readiness for Enhanced Childbearing Process. First, we're going to go over normal pregnancy. So here's some just interesting available healthcare choices when it comes to pregnancy. 99% of births take place in a hospital. Labor, delivery, recovery is also known as the postpartum time, is typically done in separate areas of the hospital. There's a labor and delivery area, and then there's a postpartum area. Just to take note there, the first 2 hours of postpartum is usually still in the labor and delivery room. There are birthing centers that stand apart from hospitals. These have to be low-risk pregnancies only. They're a little more homey. They have like lounging areas and kitchens, and usually they have to be in a certain vicinity of a hospital. And then home births, less than 1% of total births are home births, and with those is an increase of neonate death that is 2 to 3 times greater than if the baby was delivered in a hospital. So there's several factors that can affect pregnancy, and I'll have you take a look at this graph here, and you can kind of look and see like how things may affect the pregnancy, such as like socioeconomic status. Do they have the means to get food, to go buy the groceries? Do they have a car? Do they have an ability to get to the hospital? Do they have ability to pay for their bills? That kind of thing. So you can see where those things would affect a pregnancy. So you can pause this here if you need to in order to look better into the different things that could affect a pregnancy. So maternal weight gain during pregnancy is expected. Okay, this is an essential part of a normal pregnancy. The weight gain comes from several different things. First off, you've got the placenta that weighs quite a bit. You have the baby that will have some weight to it, plus the amniotic fluid. And then there's the additional fluid that the pregnant woman will have on them. There's increase in blood as well as other fluids inside the body. So that's where this weight gain comes from. So weight gain is determined by patient's weight for height. So a normal weight person would need to gain roughly 25-30 pounds. An overweight person would need to gain 15 to 25 pounds. And an obese person would only need to gain about 11 to 5 pounds. And then just really stressing the point that pregnancy is not an appropriate time for weight loss. Believe it or not, there's a lot of social media things out there that are kind of like, hey, pregnancy is the perfect time to lose weight, eat healthy, get, active and stuff like that. And really research says, well, this isn't the ideal time. Sometimes it does happen that, somebody that might not eat very well before they're pregnant, that when they become pregnant, they're eating more fruits, eating more vegetables, less of the greasy, fatty foods and things like that, just to be, better. And they might lose weight from it, but as long as they're like not intentionally losing weight and fetus seems to be growing appropriately, then it's considered okay. So pregnancy length. How long does a pregnancy last? It lasts about 9 calendar months or 10 lunar months. There's 3 trimesters to a pregnancy. The first trimester is weeks 1 through 13. The second trimester is weeks 14 through 26. And the third trimester is weeks 27 through 40. And as we're, watching and monitoring the progress of a pregnancy, we'll often, measure it in terms of, okay, this woman is 24 and 3 days pregnant, or 24 and 1 day pregnant. Something like that is how precisely we're going to be measuring this. And then how do we determine due date? One of the things that you're going to have to know is Nagel's rule. So with Nagel's rule, you have to take LMP. LMP stands for last menstrual period, which is the first day of their last menstrual cycle. So if they had a menstrual cycle, we'll say November 1st through the November 7th. So the first day of their last menstrual cycle will be November 1st. Okay. And then Nagel's rule says we take that date and then we subtract 3 months and add 7 days. And that's our due date. So if we're going to go with like the November 1st, we subtract 3 months. So 11 minus 3 is going to be 8. So we're looking at August. And then I said the LMP was November 1st. So taking 1 plus the 7 days is the 8th. So the due date would be August 8th the following year. There's an additional practice there. I said April 4th, 2015. So the due date, 4 minus 3 is going to be 1. So you're looking at January. And then 4 plus 7 is going to be 11. So looking at January 11th of the following year. Babies typically will come within 7 days of the due date. Could be 7 days before, 7 days after. I think I read something that only like 2% of babies actually come on their due date. One last thing that I want to say about due dates, we do have other ways of establishing a due date. We can look at an ultrasound as well and see where baby measures and that kind of thing and how far in development they are. If the LMP and the ultrasound due date are within a week of each other, then we usually automatically go with the LMP as the most accurate date that we can assign. If it's beyond that week apart, then we'll go with the ultrasound date. Terms used to describe pregnancy. There's just various terms that we use throughout healthcare and OB and kind of getting idea of where this woman is in terms of their pregnancy history and things like that. So gravida we refer to as a pregnant woman. Okay, gravidity is the number of pregnancies that they have. Okay, so pregnancies, the 2 pink lines on the stick, the positive pregnancy test, person is pregnant. Multigravida is a person that has had 2 or more pregnancies. Multipara is a woman who has completed 2 or more pregnancies to 20 weeks of gestation. Nullagravida is a woman who has never been pregnant and is currently not pregnant. Nullipara is a woman who has not completed a pregnancy with a fetus or fetuses beyond 20 weeks pregnant. And as you guessed it, parity, this is the number of pregnancies in which the fetus or fetuses have reached 20 weeks gestation. This is not the number born. This is how many pregnancies have made it past 20 weeks. This number does not change with stillbirths either. So if you have a stillbirth at 32 weeks, they still have a para of 1. Post-date or post-term pregnancies, these are pregnancies that go beyond 42 weeks. We don't like these. When you get past the 41 weeks, you're looking at a very much an increased risk of stillbirth or other complications happening. Things that happen inside the pregnancy would be, just the amniotic fluid dries up, meconium, so the fecal matter that's developing inside the baby could be expelled and into the amniotic fluid. The placenta starts kind of wearing down. There's all these different things that happen. So we don't like pregnancies to go beyond 41 weeks generally. Preterm is a pregnancy that ends before fetal development, so anything before 37 weeks and after 20. Prima gravida, this is a woman who is pregnant for the first time. Term pregnancy, this is a pregnancy that ends between 38 and 41 weeks. And then viability, this is the ability to live outside of the uterus. This number is usually 24 weeks. When you hear viability, usually you're thinking 24 weeks. That is kind of an old number, but it is a number that most hospitals still go by. I have a cousin that's a neonatal nurse, and she said, or a NICU nurse, and she said she's seen babies, 22, 21 weeks born and surviving outside the womb. So we'll see if that number changes, but right now you kind of stick with that 24 weeks. All right, so what do we do with all these terms and things like that we just talked about? Well, like I said, this is kind of a quick way for us to get a good visual of what this person's pregnancy history is. So we have a 5-point system and a 2-point system. The 5-point system is going to be that GTPAL. So G is gravidity, which is going to be how many pregnancies has this person had. It doesn't matter if it's a multifetal, meaning if there's twins or triplets. It doesn't matter if there's a miscarriage. It's how many total pregnancies this person has. So if if they have the 2 pink lines, that's a 1. Okay. Say they have a stillbirth at, 34 weeks with that one. Well, that gravidity is still there. Okay. Term, these are how many pregnancies made it to term. Preterm is going to be how many pregnancies were preterm. Abortions, usually these are going to be specified elective or spontaneous. Spontaneous abortions are the same thing as miscarriages, whereas elective abortions would be like, the person wanting to have the abortion done, to have the fetus removed. And then L is the number of living children. So the L is where we kind of have some variety if there are multifetal pregnancies. So if you have twins, then, that's where that fetus can, or the that number can alter. So if you have a person that is a gravida 1, but say they were pregnant with twins, then living children, and both of them survive, pregnancy and birth, then they would be 2 for living children. Gravidity and pair is the 2-point system. This is very just, kind of straight to the point. So how many pregnancies total and how many have made it past 20 weeks. So, and also not affected by like multifetal pregnancies. And not, this number, very important, is not updated until after the hospital stay post-delivery. So meaning, if this is their first pregnancy and first parity or whatever, so they're going to be a gravida 1, para 1. But if we go with that 5-point system for living children, we're still going to say 0 because it doesn't get updated till after they leave. All right, describe the various types of pregnancy tests. So there's quite a few ways that we can determine a pregnancy. One of them is a urine HCG test. This is probably the most popular way of finding out if somebody is pregnant. These are available over the counter. They're pretty cheap. Just a warning, the cheaper the test, the less accurate it's going to be. I've seen people bring in false positives before, and they're like, well, it was in the $1 section in the checkout aisle at Walmart. Probably not that great of a quality test. But we can also do these in the doctor's offices as well, or in a laboratory. What they're looking for is the hormone HCG. That is the pregnancy hormone. And it takes a little while for that hormone level to be detectable in the urine, but usually you have to wait till after the first missed menstrual cycle. So like if your menstrual cycle was due March 28th and it's March 30th, it hasn't been there yet, that's when you can go ahead and take your pregnancy test, and it's supposed to be pretty accurate at that point. And then judgment call, and depends on the sensitivity of the test, like how much of that hormone was in the urine. Another way is a serum HCG. So there's 2 different types of serum HCG. So this is going to be the level in the blood. It has to be done at a doctor's office. We can do a qualitative or a quantitative count. So a qualitative is going to be positive or negative. Yes, they're pregnant. No, they're not pregnant. And then the quantitative result is going to be how much of that HCG. So what we want to see with that HCG is if we're going to do multiple levels, we want to see that number increase. The number increasing shows that we're having a successful pregnancy. Now we get to a certain point and that number kind of starts dwindling away a little bit after the first trimester, but in that first trimester, it should grow exponentially. So if you look, I've got a chart there that, if they're 3 weeks pregnant, the blood level could be anywhere from 5 to 50. And then if you get down to 9 to 12 weeks, you see where it's anywhere from 25,000 to 288,000. So the number can vary quite a bit. If you have a slow increase, it could mean that a miscarriage is on the way or that there's an ectopic pregnancy. All right, so we need to differentiate between presumptive, probable, and positive signs of pregnancy. So presumptive, these are going to be changes felt by a woman. Amenorrhea, so that lack of period, fatigue, nausea, vomiting, quickening, which is that little fluttering feeling of the baby, urinary frequency, breast changes, deepening of pigmentation. So these are presumptive, that might not be 100% guaranteed, but could be a pregnancy. Probable, these are going to be observed by an examiner. We'll talk about these in more detail coming up, but Goodell sign, Chadwick sign, Heger sign, ballotment, having a positive HCG test, that is still a probable sign. Okay, having Braxton Hicks, abdominal enlargement, there are other things that can cause a false HCG positive test. So that's why it's still in the probable. Positive, these are going to be things that are attributed to the presence of a fetus. So hearing that fetal heart tone, finding the fetus, getting that fetal heart tone, or visualizing the fetus on ultrasound, those are going to be positive pregnancy signs.